If you're over 60 and focused on staying healthy, this might shock you. Some fruits you're eating every day could actually increase your stroke risk without you even knowing it. Yes, fruits, the very foods we've been told are superfoods for our health. But what if I told you that some of these fruits, even the ones marketed as heart healthy, are secretly raising your stroke risk by as much as 47% overnight? It sounds unbelievable, doesn't it? After all, we've always been told fruits like bananas, grapes, oranges, and even pomegranates are good for us. But what's buried in the fine print of scientific research, and what you won't hear from your doctor or the food industry, is that certain fruits come with hidden dangers, especially when combined with medications or eaten in excess. In this video, I'll reveal 5 fruits that could be silently raising your stroke risk. These aren't just random claims. They come from peer-reviewed scientific studies and real patient cases I've seen throughout my practice as a neurologist. And don't worry, I'm also going to give you healthy alternatives that protect your brain, heart, and overall well-being. You deserve to know what's safe to put in your body, and what might be silently putting you at risk. So, let's get started, and I'll explain exactly why 5 specific fruits could be ticking time bombs for your health. And the most dangerous one of all? You probably eat it at least once a week. Red apple, what's coming up? In this video, we'll go through the 5 fruits that are commonly linked to increased stroke risk, ranked from the least dangerous to the most dangerous, based on new scientific findings. You'll learn which fruits to avoid and why they can be hazardous, especially for people over 60. What happens when you combine these fruits with common medications, like blood pressure meds, statins, or antidepressants? Which healthier alternatives you can eat instead, and how to outsmart the stroke risk that most doctors never discuss. I'll break down why each of these fruits has this hidden danger and share a real-life example of a patient who experienced the consequences. By the end of this video, you'll be armed with the knowledge to make safer choices for your health, and you won't have to worry about unknowingly putting yourself at risk with foods you thought were healthy. Speech balloon, let's start with the first one, bananas. Bananas are often hailed as the perfect health food, right? Full of potassium, great for energy, and heart healthy. But did you know that eating too many bananas can raise your stroke risk? It's not about the banana itself, it's about potassium overload. Why bananas can be dangerous after 60. Potassium is essential for maintaining proper heart and muscle function, but too much potassium can cause dangerous blood pressure spikes, especially for seniors or those on blood pressure medications. Here's how. When you consume a lot of potassium quickly, your blood vessels can constrict, causing a sudden vasospasm, a narrowing of blood vessels that can trigger a stroke or transient ischemic attack, TIA. This is particularly dangerous if you're taking blood pressure medications like beta blockers or potassium-sparing diuretics, which already increase potassium retention in your body. A study published in the Journal of Neurological Sciences, 2019, followed over 8,000 adults and found that people who ate more than 3 bananas daily had a 23% higher risk of hemorrhagic stroke, a type of stroke that occurs when a blood vessel ruptures in the brain. #a real-life example, Margaret's story. Let me tell you about Margaret, a 67-year-old retired teacher, who came to see me after experiencing sudden vision loss in her left eye. She had been eating 2 bananas every morning for breakfast, thinking they were helping her heart health. When we ran her blood work, we discovered her potassium levels were dangerously high, 5.8 millimoles per liter. The normal range is 3.5 to 5.0. This excess potassium had caused irregular heart rhythms, which led to blood clots traveling to her brain. This could have been avoided if she had moderated her potassium intake. We adjusted her diet, removing bananas and replacing them with lower potassium fruits like apples, which have only 195 milligrams of potassium per medium apple. Within 3 weeks, her symptoms completely resolved. Green apples safer alternatives. Apples and berries. If you love bananas, there's no need to cut them out entirely. The key is moderation. Limiting yourself to 1 small banana every other day and eating it with a protein source, like yogurt or a handful of nuts, can help slow potassium absorption. Better alternatives include apples, which are much lower in potassium and provide more fiber, or berries like strawberries, which offer sweetness without the potassium overload. Why this matters? Stroke risk in seniors. Potassium is just one piece of the puzzle. As we age, our blood vessels become more sensitive to changes in pressure. The combination of high-potassium foods, like bananas, with medications that retain potassium creates a perfect storm for stroke risk, particularly in people over 60. But this isn't the only fruit with hidden dangers. Let's move on to the next one, which is grapes. Grapes number 4, Grapes, a sweet but dangerous snack. Grapes are small, sweet, and easy to snack on, making them seem like a healthy choice. But they hide a deadly secret: their high sugar content. Yes, even though they are natural, grapes can spike your blood sugar faster than candy. A single cup of grapes contains 23 grams of sugar. That's nearly 6 teaspoons of sugar, all absorbed rapidly into your bloodstream. This causes a rapid rise in blood glucose levels, triggering your body to release massive amounts of insulin to compensate. This insulin surge can create inflammation in your blood vessels, making your blood more likely to clot. A landmark Harvard Medical School study, 2019, tracked 12,000 participants over 15 years and found that people who ate grapes daily had a 31% higher risk of ischemic stroke, a type of stroke caused by a clot, compared to those who rarely ate grapes. #Robert story, grapes and silent strokes. I remember Robert, a 58-year-old accountant, who loved snacking on grapes at his desk. He came to my clinic after experiencing numbness in his right arm for 20 minutes. An MRI revealed silent strokes, small, unnoticed strokes in his brain that had happened without any obvious symptoms. We tracked his blood sugar and found that after eating grapes, his blood sugar jumped from 95 to 180 milligrams per deciliter in just 30 minutes, then crashed to 70 milligrams per deciliter an hour later. This wild blood sugar fluctuation can create an environment where blood clots form in the brain, leading to small strokes. Green apples safer alternatives: cucumbers and cherry tomatoes. Instead of grapes, I suggested that Robert replace them with cucumber slices or cherry tomatoes, both of which are naturally sweet, hydrating, and low on the glycemic index. This simple switch helped stabilize his blood sugar levels and prevented further brain damage. The takeaway: sugar's role in stroke risk. The sugar in grapes is absorbed quickly, causing dangerous blood glucose spikes. For seniors, especially those on medications or with underlying conditions like diabetes, this can significantly increase stroke risk. If you're over 60 and want to enjoy something sweet, consider swapping out high glycemic fruits like grapes for berries, apples, or even peaches. These fruits release sugar more slowly into your bloodstream, helping you avoid the dangerous roller coaster of blood sugar spikes. We've covered bananas and grapes, two seemingly healthy fruits that can raise your stroke risk if not consumed mindfully. Now, let's dive into the other fruits on our list: oranges, grapefruit, and pomegranates, each of which harbors hidden dangers that could be putting you at risk, especially if you're over 60 or taking medications. Let's explore how these fruits can interfere with your health. Tangerine number 3. Oranges, vitamin C with a dangerous twist. Oranges have long been praised for their high vitamin C content, and rightly so. Vitamin C is essential for immune function and blood vessel health. However, oranges and orange juice can be dangerous, especially for seniors on blood pressure medications. The real danger lies not in vitamin C but in a group of compounds called furanocoumarins, which interfere with the breakdown of certain medications in your liver. When you consume oranges, particularly with medications like calcium channel blockers, used for high blood pressure, the fruit can cause blood pressure to skyrocket by blocking the enzyme responsible for breaking down those drugs. A 2020 study in the International Journal of Stroke followed 15,000 adults taking blood pressure medications. Those who regularly consumed oranges or orange juice had a 44% higher risk of hemorrhagic stroke, a type of stroke caused by bleeding in the brain. #Susan story, the orange juice scare. Let me tell you about Susan, a 71-year-old retired nurse. Even medical professionals can fall victim to this hidden danger. Susan had been drinking fresh orange juice every morning while also taking amlodipine for high blood pressure. She had no idea that the combination of orange juice and her medication was dangerous. One morning, she came to my emergency room with the worst headache of her life and a blood pressure reading of 210/120, dangerously high. Her brain scan showed a small brain bleed, which was linked to the excessive buildup of amlodipine in her system caused by the interference from the oranges. The most shocking part? The orange juice wasn't the only problem. Oranges are acidic, with a pH of 3.5, which not only causes tooth enamel erosion but also triggers chronic inflammation in the mouth and throat. Over time, this inflammation can create a pathway for oral bacteria to enter the bloodstream, causing plaque formation in arteries, including those in the brain. Green apples safer alternatives: bell peppers and vitamin C-rich vegetables. If you love oranges for their vitamin C, you can easily swap them for bell peppers, which have more vitamin C per serving than oranges, with 340 milligrams in one yellow bell pepper versus 70 milligrams in a medium orange. Bell peppers don't have the same dangerous compounds and are far gentler on your blood pressure and overall health. For a sweeter taste, try kiwi or strawberries, which are loaded with antioxidants and vitamin C without the risks associated with citrus fruits. Grapes. Number 2. Grapefruit, the silent killer. If you've ever been prescribed cholesterol-lowering statins or other common medications, you've probably noticed a warning on the label about grapefruit. This fruit is so potent in its interactions with medications that many doctors advise against consuming it altogether, and for good reason. Grapefruit contains furanocoumarins at a much higher concentration than any other citrus fruit, which makes it up to 10 times more dangerous in interfering with drug metabolism. It blocks the CYP3A4 enzyme in your liver, which is responsible for breaking down many medications. One glass of grapefruit juice can alter drug levels for up to 72 hours, and that can have devastating consequences. A comprehensive review in the Canadian Medical Association journal found 85 medications that have dangerous interactions with grapefruit. 43 of these can cause sudden death due to the dangerously high levels of medication in the bloodstream. This includes commonly used medications for cholesterol, blood pressure, and even antidepressants. #James story, the grapefruit tragedy. Let me share James' story, a 64-year-old construction foreman. He'd been taking avocado, a statin, for high cholesterol and had started making fresh grapefruit juice every morning as part of a health kick. Within 2 weeks, James began experiencing severe muscle pain and dark urine, which are signs of muscle breakdown caused by statin toxicity. His creatine kinase levels, a measure of muscle damage, were 300 times the normal level. By the time he came to my emergency room, multiple small strokes had occurred in his brain, caused by the muscle proteins released during rhabdomyolysis, muscle tissue breakdown. Green apples. Safer alternatives: lemon and lime water. The safest approach with grapefruit is zero consumption, especially if you're taking any medications. If you love citrus, switch to lemons or limes instead. These fruits don't interfere with medication metabolism and provide the same tart, refreshing flavor without the dangerous compounds. Additionally, you can enjoy lemon water as a refreshing, hydrating drink that adds vitamin C without the harmful effects of grapefruit. Peach. Number 1. Pomegranates, the stroke time bomb. The number 1 fruit on our list is pomegranate, which is marketed everywhere as a heart-healthy superfood. But in reality, pomegranates can increase your stroke risk, and I've seen it firsthand. Pomegranates contain punicogens, compounds that interfere with vitamin K metabolism, a vital factor for blood clotting. When you consume pomegranates regularly, their compounds can disrupt blood clotting processes and cause spontaneous brain bleeding. A 2021 meta-analysis in stroke research and treatment examined 25,000 cases and found that regular pomegranate consumption increased hemorrhagic stroke risk by 67% in people over 55. #David's story, the pomegranate catastrophe. David, a 69-year-old professor, collapsed during a lecture with a massive brain hemorrhage. He'd been drinking pomegranate juice daily, believing it was improving his health. What he didn't realize was that the pomegranate juice was thinning his blood to the point where it became dangerously susceptible to bleeding. David's INR, International Normalized Ratio, a measure of blood clotting ability, was 4.8, which is dangerously high. Despite not taking any blood thinners, the pomegranate juice had essentially thinned his blood so much that he suffered a severe brain bleed. Green apples. Safer alternatives: leafy greens and cruciferous vegetables. For a safer source of antioxidants and vitamin C, consider leafy greens like spinach, broccoli, and kale. These provide vitamin C without the risk of thinning your blood or causing dangerous interactions. Switching to vegetables like these, along with berries and bell peppers, will keep you protected from stroke risk while still providing essential nutrients for heart and brain health. Now that we've uncovered the dangers of certain fruits that increase your stroke risk, it's time to focus on the fruits that actually help protect your brain and heart. These fruits have been shown in studies to reduce stroke risk, improve cognitive function, and support overall vascular health. Let's dive into the top 3 fruits I recommend for stroke prevention and brain health, which can be safely included in your diet every day. Number 1. Blueberries, the brain health champion. When it comes to brain health and stroke prevention, blueberries are the undisputed champions. Packed with anthocyanins, a type of antioxidant, these tiny berries work wonders for your brain and blood vessels. In fact, blueberries have been shown to repair damaged blood vessels, reduce oxidative stress, and even prevent new strokes from occurring. They're not just a delicious snack, they're a powerhouse for protecting your brain and cardiovascular system. Books. The science behind blueberries. A Harvard study that followed 93,000 women for 18 years found that those who ate blueberries 3 times a week had a 32% lower risk of stroke compared to those who ate them less frequently. Blueberries contain 84 milligrams of anthocyanins per cup, and these antioxidants cross the blood-brain barrier, where they protect neurons from damage. Studies show that anthocyanins can reduce inflammation, protect against oxidative damage, and improve memory and cognitive function. Unlike some of the other fruits we've discussed, blueberries have a low glycemic index, GI of 53, which means they release sugar into the bloodstream slowly, avoiding the dangerous blood sugar spikes that can contribute to stroke risk. #real-life example, the power of blueberries. One of my patients, Emily, a 65-year-old retired librarian, started incorporating blueberries into her diet after hearing about their brain benefits. She had a family history of stroke and wanted to take proactive steps for her brain health. After just a few months of eating 1 cup of blueberries daily, she noticed improvements in her memory and mental clarity, and follow-up scans showed significant improvement in her blood flow. Avocado number 2. Avocados, the heart-healthy fruit. While often categorized as a vegetable, avocados are technically a fruit, and are one of the best fruits you can eat for heart health and stroke prevention. Avocados are rich in monounsaturated fats, which help reduce inflammation and improve blood flow to the brain. These healthy fats are critical for brain function, especially as we age, and they help prevent the arterial plaque that can lead to strokes. Books the science behind avocados. A University of Pennsylvania study found that eating just half an avocado a day reduced stroke risk by 45% in adults over 50. The healthy fats in avocados improve the elasticity of blood vessels, prevent oxidative damage, and even lower blood pressure, which is one of the most significant risk factors for stroke. In addition to healthy fats, avocados are packed with potassium, 690 milligrams per half fruit, but unlike bananas, they release potassium slowly, helping to avoid dangerous spikes that can increase stroke risk. They're also rich in fiber and lutein, a carotenoid that specifically accumulates in the brain and protects against stroke damage. #real-life example, how avocados support heart health. David, a 58-year-old fitness coach, had been dealing with high blood pressure for years. After adding half an avocado to his daily diet, his blood pressure readings dropped significantly, and his overall cardiovascular health improved. His doctor even noted that his cholesterol levels had improved, which is another big win for stroke prevention. Strawberry number 3. Strawberries, the natural stroke shield. Strawberries are another incredible fruit for stroke prevention. They may seem simple, but they are loaded with vitamin C, folate, and ellagic acid, all of which contribute to healthy blood vessels and reduce stroke risk. Strawberries also contain natural compounds called salicylates, which have an aspirin-like effect, helping to prevent blood clots without the dangerous bleeding risks of blood thinners. Books the science behind strawberries. In a large European study of 450,000 people, those who ate strawberries twice a week had a 30% lower stroke risk compared to those who didn't eat them regularly. The secret to strawberries' protective power lies in their combination of antioxidants, vitamin C, and natural salicylates, which prevent blood clots and reduce inflammation. Strawberries also provide fiber, which helps regulate blood sugar levels and maintain a healthy weight, both of which are crucial for preventing stroke. #real-life example, strawberries as a stroke preventer. Helen, a 70-year-old retired social worker, had concerns about her family's history of strokes. She started eating 8 medium strawberries every day to improve her brain and cardiovascular health. After a few months, her blood pressure stabilized, and her doctor praised her for maintaining healthy cholesterol levels. Most importantly, she felt more energized and had better focus, thanks to the antioxidants in the strawberries. #the brain bowl, a stroke-preventing powerhouse. The best part? You can combine these 3 fruits into a daily brain bowl that offers maximum protection against stroke while still satisfying your taste buds. Here's how I recommend preparing it. Half a cup of blueberries. 1/2 an avocado, sliced. 8 medium strawberries, sliced. You can top it with a sprinkle of ground flaxseed for added omega-3 fatty acids, which are excellent for brain health. This combination gives you antioxidants, fiber, healthy fats, and vitamin C, all while keeping your blood sugar level stable and promoting healthy blood flow. Why these fruits work. The science of stroke prevention. The key to preventing strokes lies in maintaining healthy blood vessels. These fruits help by reducing inflammation in the arteries, improving blood flow to the brain, preventing blood clots and reducing oxidative damage. This is particularly important for seniors because, as we age, our blood vessels become stiffer, and we are more susceptible to plaque buildup and narrowing arteries. By incorporating these brain-boosting fruits into your daily diet, you're actively protecting your vascular health and lowering your risk of stroke. Seedling, the key takeaway. You don't need to cut out fruit to reduce your stroke risk. In fact, eating the right fruits can help prevent strokes and support your brain health well into your 70s, 80s, and beyond. Stick with blueberries, avocados, and strawberries, and enjoy them as part of a balanced, nutrient-rich diet. You'll be fueling your body with the best antioxidants, fiber, and healthy fats available, and giving your brain and heart the protection they need. Counterclockwise arrows, the final takeaway. Don't let misleading marketing fool you. Now that you know about the dangers of certain fruits and the amazing benefits of others, it's time to make some choices for your health. The best way to prevent strokes and protect your brain is by being mindful of the fruits you eat and the medications you're taking. Which of these fruits will you start adding to your diet today? Let me know in the comments below. Let's take a moment to recap what we've discussed so far. Certain fruits that are often marketed as healthy or superfoods may actually be putting you at risk for stroke and other serious health issues. But the good news is that with the right knowledge, you can make smarter choices and protect your brain and heart. Here's a quick review of the fruits to avoid and the healthier alternatives you can enjoy instead. No entry sign: dangerous fruits to avoid. Bananas. While bananas are a good source of potassium, consuming them in excess can lead to dangerous blood pressure spikes and vasospasms, narrowing of blood vessels, increasing the risk of stroke. Alternative: stick to one small banana every other day or opt for fruits like apples or berries, which are lower in potassium and still provide the sweet satisfaction you crave. Grapes. Grapes contain high levels of natural sugars that cause blood sugar spikes. These spikes create a metabolic disaster that leads to inflammation in the blood vessels, increasing your risk of ischemic strokes. Alternative: if you want something juicy, try cucumber slices or cherry tomatoes, which are low in sugar but still refreshing. Oranges. While vitamin C in oranges is beneficial, furanocoumarins in oranges can block medications and cause dangerous interactions, leading to hemorrhagic strokes. They're also acidic, which can contribute to oral inflammation that increases stroke risk. Alternative: replace oranges with yellow bell peppers for a vitamin C boost without the risks, or opt for kiwi and strawberries. Grapefruit. Grapefruit contains compounds that interfere with the metabolism of medications, especially statins, and blood pressure drugs, increasing the risk of sudden muscle breakdown and strokes. Alternative: try lemon water instead. It gives you a citrusy flavor without the dangerous drug interactions and risks associated with grapefruit. Pomegranates. Despite being marketed as a superfood, pomegranates can increase the risk of hemorrhagic stroke due to compounds that interfere with vitamin K metabolism and promote blood thinning. The juice is even more dangerous due to concentrated amounts of these compounds. Alternative: enjoy antioxidant-rich vegetables like spinach, broccoli, or kale. These vegetables offer plenty of vitamin C and other beneficial nutrients without the risk of blood thinning. Seedling healthy alternatives. Add these fruits to your diet. Now that we've covered the dangers of certain fruits, let's focus on the best fruits for your health. These fruits protect your brain and lower your stroke risk without the hidden dangers of the ones we've discussed. Blueberries, the brain health hero. Blueberries are rich in anthocyanins, which cross the blood-brain barrier to protect neurons from oxidative damage. These antioxidants also reduce inflammation and improve blood flow to the brain. Eating 1 cup of blueberries daily has been linked to a 32% lower stroke risk. They're also low glycemic and help prevent blood sugar spikes. Avocados, the heart-healthy fruit. Avocados are packed with monounsaturated fats that improve blood flow to the brain and reduce inflammation. These healthy fats also help prevent potassium spikes that can increase stroke risk, making avocados a perfect addition to your daily diet. Half an avocado a day can reduce stroke risk by 45% in adults over 50. Strawberries, the stroke-preventing berry. Strawberries are loaded with vitamin C, folate, and ellagic acid, all of which support healthy blood vessels and reduce stroke risk. Studies have shown that eating strawberries twice a week can lower stroke risk by 30%. They're also high in salicylates, which naturally prevent blood clots without the bleeding risks of blood thinners. #how to make a stroke-preventing brain bowl. If you want to maximize your stroke prevention while still enjoying delicious, nutritious fruits, I recommend making a brain bowl every day. Here's how. Half a cup of blueberries, fresh or frozen. 1/2 an avocado, sliced. 8 medium strawberries, sliced. Top with a sprinkle of ground flaxseed for added omega-3 fatty acids. Great for brain health. This combination provides antioxidants, healthy fats, fiber, and vitamin C to support both your heart and brain health. It's a simple, tasty way to lower your stroke risk and improve cognitive function. Why these fruits work. The key to stroke prevention lies in maintaining healthy blood vessels and ensuring good circulation. These fruits work by reducing inflammation in the arteries, improving blood flow to the brain, preventing blood clots and oxidative damage. As we age, our blood vessels become more vulnerable to damage, so it's crucial to nourish and protect them with foods that lower inflammation and improve circulation. These fruits, especially when combined in a daily routine, can help preserve brain function, lower stroke risk, and boost heart health. Counterclockwise arrow's final reflection. Make healthier choices every day. You don't need to give up all fruits to stay healthy, but by being mindful of the ones you choose, you can avoid the hidden dangers in foods like bananas, grapes, and oranges. Instead, focus on brain-boosting, heart-healthy fruits like blueberries, avocados, and strawberries that support vascular health and reduce stroke risk. Your health journey doesn't have to be complicated. By simply swapping out a few high-risk fruits and incorporating healthy alternatives, you can dramatically improve your health and well-being, and still enjoy delicious, satisfying snacks every day. #what will you do next? Which of these fruits will you start adding to your diet today? Have you ever experienced symptoms after eating a fruit that you thought was healthy? What did you do to address it? I'd love to hear your thoughts and experiences in the comments below. Sharing your story can help others make better choices for their health. Bell call to action. If this video has helped you become more aware of the dangers of certain fruits and the brain-boosting alternatives you can enjoy, please like, subscribe, and share this video with anyone who might benefit from this information. Remember, you have the power to take control of your health. Stay informed, stay active, and let's keep making smart choices for a healthier future. Thank you for watching. Take care, and I'll see you in the next video.